Hello, and welcome to Preserve HealthTalks. Today we're going to talk about something that everybody wants to know more about, flu vaccines. Whether you're for it or against it, do you need it, do you not need it, who's it indicated for, and common myths about the flu vaccine. We're going to try and discuss all that in the next 10 minutes on our podcast, Preserve Health Talks. Remember, you can find us on our YouTube channel at Preserve Health Talks. To get more information, you can go to our website at preservehealthmd.com or call the office directly at 772-252-1425. My co-host and my junior partner is Leah Ginn, APRN, DNP. Good morning.
Good morning.
How are you?
Good. How are you?
Good. Let's talk about the flu.
Let's do it.
Yeah, the flu's bad.
It's going around.
It's going around.
Lots of people in our office, patients are testing positive.
Absolutely. And people tell me all the time, or they ask me all the time, should I get the flu vaccine? And unequivocally, my answer is yes, you should get the flu vaccine. It's been said to me in the past by several professors and during my training that the indication for getting the flu vaccine is being alive. If you're alive, you should get the flu vaccine. And if you're over 6 months of age, then an annual flu vaccine is recommended because that virus changes every year.
There's different strains with every flu season. That's why it's annual.
And there's flu A and there's flu B. And because these viruses shift and mutate from year to year, the flu vaccine is indicated every year for every person over the age of 6 months.
Yeah, and typically we see the flu season starting even as early as August, but typically September to November is a great time to get vaccinated since that's when we see the peak cases, but it can go all the way through May.
Right. If you're a little older, then you might want to wait a little bit later in the season to get the flu vaccine because your immunity may not last the entire season. And we are seeing flu late into the season, and it's getting later. It seems to be every year to me.
Yeah.
People also ask me all the time, which is worse, flu A or flu B? Well, flu A is generally worse than flu B. When you recommend.
I agree.
When you agree with that? Yeah.
Yes.
So why is that? Well, flu A is more toxic, and you have worsening symptoms. Flu A is also harder to predict because people that get flu A, it's not just people. Animals get flu A. The only animals that get flu B are seals. Yeah, there's just a little trivial fact that you might want to know.
That's good.
Only seals get flu B, but flu A, it's birds and pigs and cattle, and so because the virus can mutate from animals back to humans, it's important to get that flu vaccine every year. There are special groups that should get the flu vaccine, right?
Yes.
Who?
Yes.
Like who?
So some special groups, obviously healthcare workers, anyone who's coming in close contact with high-risk individuals is also another really important group to get vaccinated. Pregnant patients in any trimester, is that correct?
Absolutely. Pregnant patients in any trimester. And the reason for that is the flu vaccine is not a live virus. Live viruses are not indicated in pregnant women. Inactivated viruses, which are basically dead viral particles, are indicated. That's why children aged 6 months or less should not get the flu vaccine because they can't build an immune response, but they get that passive immunity from the mom who's already been vaccinated.
Right.
And that keeps them protected from birth to 6 months of age.
Right.
And the first time you get a flu vaccine at 6 months of age, you really need two vaccines separated by about 4 weeks.
Yep, exactly. Exactly. And then, of course, patients with any chronic lung disease, COPD, asthma, diabetes, cardiovascular disease. I mean, you name it, you probably need the flu vaccine, like you said.
Right. And healthcare workers.
Yes.
Essential workers and caregivers. Caregivers, particularly for chronically ill patients, they need the flu vaccine as well to help protect the person that they're taking care of, as well as themselves.
Right. And then there is just a few contraindications, right? One being an allergy to egg, but they do make egg-free formulations.
They do. Well, actually, egg allergy used to be a contraindication, but it's no longer a contraindication to the flu vaccine.
Wow.
Yeah, you can, if you have an egg allergy, and the egg allergy is mild, that you have some itching or even some hives, you can get the vaccine, but get it at a physician's office. Don't get it at a pharmacy or some type of a grocery store or a community center. You want to go to your doctor's office. What about severe egg allergy? Well, you could still get a flu vaccine. And if you're still concerned about getting the flu vaccine with severe egg allergy, they make Flu Block, which is a vaccine that does not have egg protein in it. Mm-hmm. So that egg albumin is what the allergy is to, the protein in the egg, and the Flu Block does not have egg in it. So
Yeah.
So you can get
What
that.
other contraindications?
Well, Guillain-Barré syndrome, certain neurologic diseases, but you know, only 1 in a million patients will get Guillain-Barré, which is a neurologic disease, from the flu vaccine.
Right.
And the flu
The flu
itself
itself can
cause Guillain-Barré with a higher incidence of Guillain-Barré than the actual flu vaccine. Now, there's been a lot of talk about autism and vaccines and what they put in vaccines like aluminum
mercury.
and mercury. Let's talk about those for a second. Aluminum is an adjuvant to vaccines which helps increase the immune response. And it's a very, very minuscule amount.
Right.
Good news, though.
The flu shot doesn't contain
Flu
any
shot doesn't
aluminum.
have any aluminum in it. What about mercury? Well, most offices use single-dose vaccines.
Right.
Single-dose vaccines do not contain mercury. It's only the multi-dose vaccines that have the preservative in it, and I think the preservative is called thimerosal.
Yes.
And thimerosal has mercury in it, but it's ethyl mercury, not methyl mercury. And the difference is it's a different alcohol.
Right.
And ethyl mercury is rapidly metabolized and doesn't build up the neurotoxins that methyl mercury does.
Yes. Your body does a good job of excreting it, and it doesn't accumulate.
Rapidly. It's rapidly excreted. So those would be the reasons not to get the flu vaccine, but there are very, very few contraindications to the flu vaccine, and you're much better off with it than you are without it.
Right.
In the last few minutes, let's talk about some myths with the flu vaccine.
Yes.
So we're going to do a true or false, and let's just go over some of the myths about the flu vaccine.
I think one of the best ones is that the flu shot gives you the flu.
Right. Every time I get the flu shot, I get the flu. True or false?
That is false.
That is false. The flu shot never gives you the flu.
You may have some mild side effects from the vaccine, which just is your immune system is responding.
Absolutely.
Right?
Absolutely.
Yeah.
But remember, no vaccine is 100% effective. You can still get the flu if you've had the flu vaccine, but you would have a mitigated response.
Right.
Your flu will be much milder and much shorter.
And even if you have the flu, once you've recovered, we still recommend to get the flu shot because you may have had a different strain.
Right. Remember, there's flu A and there's flu B, and there are multiple strains of each that go around every year. And the CDC, Center for Disease Control, generally meets annually to predict what flu strains are going to be out from year to year.
Right.
And sometimes they hit it and sometimes they miss it, but
Exactly.
generally
Yeah.
they've gotten pretty good at getting it.
Because you can get reinfected with different strains. So
Healthy people. The
Yeah.
healthy people need the flu vaccine?
they do. They do because they, they can transmit the disease to high-risk individuals, which we've discussed. And it is recommended. They can still spread it. And they can also, even if you're a healthy individual with no prior health history, you can still have some serious complications from the flu vaccine.
Well, I got the flu shot late in the season, so it's pointless. Is that true or false?
That is false.
Right, all the answers are false because these are common myths. Flu season can really last until May or even early summer. So even if you get the vaccine late in the season, it's still beneficial. Yeah, we're running out of time. This is so fun.
Yeah.
We should come back and talk more about flu. But if you have questions about flu, give us a call at our office, 772-252-1425.
Or any topics that you want to hear.
Yeah, I'm Dr. Ira Pearlstine and
Leah Ginn.
Leah Ginn, and we're Preserve Health Talks. Thank you.